Hi everyone, thanks so much for the kind invitation to present my research. So this research is utilizing different data sources, particularly organic big data sources for public health research and social science research. I'm Quynh. I'm from the University of Maryland School of Public Health in the Department of Epidemiology and Biostatistics. So in this presentation, I'm going to be talking about two data sources in particular, Google Street View images, which help characterize the built environment, and Twitter data, which helps with the characterization of the social environment. So first, Google Street View. It's a relatively new data source considering, the other data source that we have available typically. It was launched in 2007. Google Street View is a component of Google Maps, and it's characterized by high spatial resolution images and panoramic views of homes, streets, businesses, and basically neighborhoods, as well as other scenes like interstate and parks at the eye level. So this is in contrast to satellite imagery, which you might have seen where the image is captured overhead. So the Google Street View images are typically collected by cars equipped with special cameras. They capture overlapping images to provide panoramic views. And one caveat, however, although the coverage for Google Street View images is good in the US as well as worldwide generally, the frequency at which the image is updated for any particular neighborhood is really dependent on population density. Google tends to sample more frequently from urban areas compared to rural areas, and also depend on weather conditions. So places that have more harsh weather will have fewer updates. So I'm going to first be going over a pilot study to assess built environment using Google Street View images of 3 cities. The 3 cities include Salt Lake City, Utah, Chicago, Illinois, and Charleston, West Virginia. The 3 cities were chosen for the pilot study because they represent very visually distinct places, and also they showcase how potentially Google Street View can be utilized to characterize neighborhoods in different areas of the US that have different visual aspects to them. So the data was collected over a 1 to 2 month period from December 2016 to February 2017. We sampled images of at road intersections in these 3 cities, and as well as a random sample of street segments approximately 50 meters apart. So we sampled at the road intersection, and we also sampled every 50 meters down the road. 4 images were obtained for each set of coordinates. So for any point that we selected, we would take 4 pictures for at the west, east, north, and south to try to capture a 360 view of the surroundings. The number of images captured for each city depends on how many intersections and roads there were. So we captured over 200,000 images in Chicago, 150,000 in Salt Lake, and about 50,000 in Charleston, West Virginia. We started with 3 binary outcomes that characterize the built environment: presence of crosswalk, building type. Building type was single-family detached house versus other, and street greenness. So I'll quickly go over how we arrived at this, because you might be wondering, that's potentially random collection of characteristics. The indicators were selected based upon both feasibility considerations about what computer vision models are good at and can perform well doing. They perform well when you have an object that is pretty standard in its appearance and also doesn't necessarily have that much heterogeneity. So crosswalks is quite good for a computer vision model because they have a pretty standard look to them. In addition, we also considered sidewalks, but in these 3 areas, especially sidewalks are pretty common, as especially in Chicago, and so it wasn't differentiating as much as we wanted across geographical areas in a city. So we chose crosswalk in order to have higher heterogeneity. Building type when we were looking at the images, what stood out to us is that some images had just purely residential homes. So you can kind of think about suburbs or like purely residential neighborhoods. And there were some images that had that had apartments, that had businesses, that had schools. And so this was one quite easy way and quite distinct way to categorize Google Street View images is just if the image was displaying only residential homes, single family detached homes, or if it had different building types. And this indicator was used to somewhat proxy for mixed land use or greater urban development. Street greenness, when we were looking at the pictures, most images had some kind of greeny, it had a patch of grass or had a tree. So we wanted to distinguish images that displayed more ample green landscaping or landscaping compared to those that had sparse. And so that's why the cut point of 30% seemed to, looking at the images, seemed to be a good cut point because that seemed to be able to distinguish between ample versus sparse. So in order to arrive at the models, we had to do a fair amount of labeling of the images. So in total, we labeled about 15,000 images. The majority of them are from Chicago. We additionally labeled another 2,000 from Charleston because in preliminary models, we were trying to extrapolate to Charleston, but the accuracy was dipping because the features in Charleston looked a little bit different from like that in Chicago. So we labeled specifically images from Charleston in order to improve accuracy. So after we collected, we made this data set of over 15,000 images. 80% served as a training set for the computer vision model and 20% served as the test set. We use deep convolutional neural networks, VGG16 in particular, and this is quite a common model in computer vision for object recognition. So this is the standard model, and it performed well for the three indicators that we were looking at, between 85 to 93%. So we're quite happy with that level of accuracy. These are just some sample images. Here you have a green neighborhood, you have the presence of crosswalk, you have the presence of a building that's not a single family home. Here, the green 30 indicator is 0 because you do have some trees, but it's not particularly ample. There's no crosswalk, and there is a building that's not a single family home. Here we see purely residential, so the non-single family home indicator is set to 0. We don't see crosswalk, and it's ample in terms of landscaping. And what is to note is we did label winter scenes, so the model is able to predict green space or green landscaping even if the tree is bare. So these are just some descriptive statistics of the three indicators across the three cities. In Charleston, you have the most green streets. Also, Charleston is the most rural. In Chicago, you have the most crosswalks and also the most non-single family home / commercial apartment building. When you have this type of data, you can create maps that display the spatial distribution of built environment characteristics, and you kind of see their distribution on the right. For green 30, you see that it's pretty much concentrated in one area. You can kind of see for each city that you're interested in how evenly distributed or not are the features, and below are some sample images. Salt Lake is known for its wide streets and clean streets. This is Chicago. Sample images are below. And this is Charleston. So quite different look, but the accuracy is good across the three cities, which we were happy about. So we also looked at how the built environment characteristics mapped onto demographics. So across the three cities, higher median household income was associated with more green streets and fewer commercial buildings, kind of indicating that higher median income was basically associated with living in purely residential neighborhoods. Importantly, one of the main goals was to examine these Google Street View derived indicators as predicting health outcomes. To do so, we utilize a special data source, the Utah Population Data Source database, which has individuals living in Utah and has administrative records as well as clinical records. Here we're looking at obesity and diabetes. So the model is controlled for individual level age, sex, race, ethnicity, education, marital status, as well as typical level population density and age of the population, percent Hispanic. So it's quite robust in its covariates. What we see is that, for instance, people living in the highest tertile of green streets had a 27% reduction in obesity. They also had a 14% reduction in diabetes. Crosswalks was also related to lower obesity and diabetes. And living in places that had more non-single family homes was also related to lower obesity and diabetes. So the model, this pilot study and the computer vision models demonstrate that it is feasible to utilize computer vision for automatic characterization of built environments in 3 very geographically and visually distinct areas of the United States. There are certain demographic characteristics that correlate with built environments, suggesting potentially differential access or preference for different types of neighborhoods, as we know. In Salt Lake City, we find that the health data was coming from Salt Lake City. We find that green streets, crosswalk, and commercial buildings, apartments were associated with lower obesity and diabetes, controlling for predisposing characteristics. So limitations, of course, the data is only investigating a subset of possible community features. The features possible is restricted by the ability of computer vision models in terms of the type of features that it can really accurately predict well, and the extensiveness of neighborhood features, because each feature had a computer vision model that was built for it. And so unlike other neighborhood inventories where you have hundreds of features, where people go on site with the clipboard, there's 100 features that they can log. Computer, you would have to build each model, you have to build a model for each of the features potentially, and also you would have to label for each of the features thousands of images. So there is that feasibility component when you're doing computer vision, but at the same time, it is very cost efficient. You don't have to go on site, and you can label hundreds of thousands and millions of images if you would like. Another study limitation is that the pilot study was a cross-sectional study. Okay, so I want to mention some more ongoing work for Google Street View. We had additional indicators, so we added a single lane road as another indicator of urban development. So whether the image had purely just one single lane or had multiple lanes, and also visible utility wires overhead. Because one of the things that stuck out to us was when we're looking at these images was that some images had very apparent and unsightly visible utility wires, and there's very little research on the association between visible utility wires. We look at it as an indicator of possibly physical disorder, because when you look at them, they're quite unsightly. They can discourage walking, and we use VGG16 models again for the classification of these 2 additional indicators. So we have these are the ones that are listed. We also looked at 3 or more lanes, but that is actually very rare, especially in residential neighborhoods. So here is an example of visible utility wires. Here's a suburban area, visible utility wires, as you can kind of see. Okay, so the second study utilized over 30 million images from across the United States. And for this, we sampled intersections across the entire United States. So we did an ecological study where we examined the association between Google Street View derived county characteristics and county level health outcomes. And we find that, for instance, the presence of crosswalks is related to lower premature death, lower fair to poor self-rated health, lower obesity. Likewise, non-single family home is related to better health outcomes, lower obesity, lower fair, poor self-rated health. Single lane roads, an indicator of more rurality, is associated with higher premature death. Visible utility wires is associated with higher obesity, higher fair, poor self-rated health. And this is controlling for other county level characteristics. So next we move on to analyses with individual level patient data. So in this study, we utilized 1.4 million images that characterize the built environment in Utah. And we utilized close to 1 million adult patient records from a very large healthcare provider in Utah, Intermountain Healthcare. That data, the health data, came from the 2017 to 2019 time period. Here is a spatial distribution of built environment characteristics. So we see crosswalks is left skewed, and it is the rarest of the indicators we looked at, with most neighborhoods having less than 10% in their distribution of crosswalks, 10% of images having crosswalk present. Single lane is quite common. Green 30 is bright skewed, very, very common, with the bulk of neighborhoods having between 0.6 and 100%. The images labeled as being green. Visible utility wires is unimodal. Non-single family home is left skewed, with most of the neighborhoods having less than 4% in terms of images labeled for non-single family homes. But still, that is not a rare feature. This is the descriptive statistics for the state of Utah sample. And we're looking at, I would point out that 95% of the sample is white. Obesity for the sample is around 47%. The indicators are displayed below. Crosswalks is the rarest at 5%. So here we're looking at the Google Street View predictors predicting individual level chronic conditions and substance use disorder. So we see that green streets is associated with reductions in diabetes, uncontrolled diabetes, hypertension, obesity. We see that non-single family homes are also associated with lower diabetes, uncontrolled diabetes, hypertension, and obesity. Conversely, visible utility wires is associated with worse health outcomes across outcomes that we examine. I will say that green streets and non-single family home is also an indicator of, it predicts more substance use. So it predicts less chronic conditions, but more substance use. And that is actually in alignment with a previous study that I wasn't able to cover given time constraints. But generally we find that urban development or indicators of urban development tend to relate to lower chronic conditions, but higher binge drinking, higher substance use, also higher mental distress. So we find that individuals living in communities in the highest quartile of green streets and non-single family homes have 10 to 27% reduction in chronic conditions, but higher substance use disorders, controlling for age, white race, Hispanic ethnicity, religion, marital status, health insurance, and air deprivation. Conversely, visible utility wires was associated with 5 to 10% more diabetes, uncontrolled diabetes, hypertension, obesity, and substance use. And visible utility wires, although it's like a new indicator, it's consistently across many of our, basically all the studies that we examined, was related to worse outcomes. And we looked at this association at the census tract level, at the county, at the state, and here at the individual level. And we find that it's consistently associated with worse outcomes. So we argue that Google Street View images can aid in the identification of neighbor characteristics that seem to correlate with health. So in this second study, we're looking at outcomes from the University of California, San Francisco Health System outpatient visits. So it's just a different data set to show how robust is this association in a different patient population. And the models were able to adjust for other individual level predisposing characteristics. This is the distribution of the built environment features, and below are some sample images from California. Here we have a more diverse sample. So percent white or Caucasians at 56%. So there's more, African Americans, Hispanic, and Asians in the UCSF healthcare system. So we find that green streaks again is associated with reductions in coronary artery disease, hypertension, diabetes, so better health outcomes, especially chronic conditions. We see visible utility wires associated with worse health outcomes, higher coronary artery disease, hypertension, and diabetes. And the new indicator, dilapidated building, was associated with also worse outcomes. Both visible utility wires and dilapidated buildings were utilized here as possible proxies for physical disorder. So we see that green streaks was associated with 12 to 30% lower prevalence of coronary artery disease, hypertension, diabetes compared to those living in communities in the lowest tertile of green streaks. So green streak is consistently associated with better outcomes, especially in cities. I will say that green streaks sometimes also correlate with rurality. So when you're looking at it across the US, sometimes you do find counterintuitive associations, but when you look at green streaks within cities, it is generally associated with better outcomes in the analyses we have done. Visible utility wires overhead was associated with higher prevalence of coronary arteries and hypertension, and dilapidated building was also associated with worse outcomes. So I would say the advantages of Google Street View is that it's quite efficient. It protects researchers in that they don't necessarily have to go on site to potentially some dangerous neighborhoods. It's relatively low cost compared to in-person visits and manual inventories of neighborhood features, and the data collection is not obtrusive in that we don't interact with local residents. So there are substantial limitations, of course. So Google Street View, there are different time periods at which the images are updated, and sometimes even at the same location, you might be using images from different time points. So you're relying upon Google for your data source, and you don't have any control over how often they update the image for your locations of interest. Also, the images, sometimes there might be obstructions, so cars might be in the way of features you're interested in. They will blur people to mass identities, which make pedestrian detection a little bit more difficult. Areas needed, cars go, like Google Street View images are collected by Google Cars, so streets that are not accessible by cars can't be logged by Google Street View cars. So we're finding that Google Street View is an excellent data source for investigating built environments in different areas across the US, and it is robustly predictive of health outcomes. However, ongoing work will need to have tighter control confounding. So for instance, we're looking into analyses that look at differences in neighborhood context among siblings in order to try to have a tighter control of family background characteristics. Also looking at things like the temporal changes in neighborhood context, predicting temporal changes in health. And then also expanding to include more national patient health outcomes, which is difficult to get at because you have to get a national data source with geographical identifiers. So I'm going to quickly move to the second part of the presentation, which is describing our Twitter work, in particular Twitter work around characterizing sentiment towards minorities. So as you know, there's different domains of racism. There's institutional or structural racism, and that is laws, policies, practices of society and its institution. There's cultural racism, which is the ideology, the values, the language, the simple and unstated assumptions. And then there's individual level discrimination, and this is the level most studied, where you have people interacting with each other, and there's differential treatment resulting in differential access to opportunities and resources. What And the literature is consistent in finding that unfair treatment or discrimination have been linked to an array of health outcomes. But the issue is that a lot of this data is relying upon self-report, and we're understudying social context. So it's not just about like one person's recount of their experiences of discrimination, which is very important. But you also have to try to characterize the context in which they live, in order to try to understand that it's not just about a person and another person. Like there's other forms of racism. There's more socially manifested, more structural forms of racism. And so we are leveraging social media to try to characterize the social environment, in investigating that in relationship to one particular outcome, which is birth outcomes. We chose birth outcomes for a variety of reasons. First, there's understanding that there's racial disparities in birth outcomes in the United States. They're not fully understood. They're not fully explained by prenatal care, social demographic characteristics, health behaviors. And the literature is pointing at suggesting that discrimination may play a role in terms of the experiences of Middle Eastern women and also African American Black women having experienced discrimination and relating that to adverse birth outcomes, in particular preterm birth and low birth weight. So our study is looking at developing indicators of racial attitudes and bias from Twitter data, examining its relationship to birth outcomes as a new way to assess area-level racial attitudes and bias. Twitter data, like Google Sheet View data, is timely and cost-efficient. And because Twitter data is basically short text, you're able to capture racial bias in a different form, in potentially new forms of racial hostility. Okay, so the collection was from 2015 to 2016. That was like the first study that we did. And we utilized the freely available Twitter streaming API, which randomly collects 1% of all US publicly available tweets. We restricted to the United States. And we used geotag tweets that had a corresponding latitude, longitude coordinate of where the tweet was sent. To identify which tweets were race-related, we used close to 400 race terms, and these were race categories as defined by the US Census, as well as a really comprehensive list of racial slurs. We utilize a free version software, Python. So our techniques, we try to emphasize publicly available data sources, free software, in that our data methods can be replicated and sustainable. So the sentiment analysis is quite good at 89%, so it's very accurate in characterizing sentiment. The birth outcomes came from 2015 with close to 4 million births. So in terms of percentages, about 11% of babies were preterm and 8% were low birth weight. So our analytic approach was to examine whether state-level racial sentiment was related to individual-level birth data. We also replicated the analyses at the county level. It was difficult to analyze it at smaller levels because race tweets were actually not that common, and we wanted to get stable estimates for each geographical area. So that's why we had to aggregate up to county and state. And also the birth data, the lowest level geography is the county identifier. So we were also restricted with that. With the birth data, we're able to control for state level, we control for state level expenditures on public welfare, percent non-family white, and median household income, as well as a lot of individual level characteristics available in the birth record, for instance, maternal age, sex, ethnicity, smoking, BMI, first birth status, prenatal care. So in the collection of tweets, each race tweet was also associated with a race social group. About half of the race tweets were about Blacks, African Americans, over 200,000 were about Hispanics, 270 were about Asians, and so on. So these were, although we had close to 400 race terms, these are the most common race terms that we found in our database. Sentiment. So for general tweets, the percent of general tweets that are positive is around 19%. And that is close to the percent positive of tweets where a Hispanic term is utilized or a race or an Asian related term is utilized. That's like at 18%. But when a race term that's related to African Americans or Middle Eastern, the percent positive dips to 12 and 14%, or 12.7 and 14.1%. So for Black related tweets and Middle Eastern related tweets, the percent positive rate is lower. This is the geographical distribution of Black African American related tweets that are positive. So you do see quite a fair bit of spatial distribution. So states with the least positive sentiment for African Americans were Vermont, Louisiana, Mississippi, Alabama, DC, and Connecticut, with 9 to 12% of tweets being positive when they mention a Black or African American group. We find that percent Black related tweets that are positive were the lower the positivity rate, the worse birth outcomes. So associated with worse low birth weight, very low birth weight, and preterm birth. This was true in the full population as well as among minorities. So women living in states with lower positive race-related tweets, especially tweets that mentioned Blacks or Middle Easterns, they had worse birth outcomes. We didn't see this association for Hispanic-related tweets or Asian Pacific Islander-related tweets. We did sensitivity analyses looking at geotagged tweets, which had exact geographical location, as well as non-geotagged tweets, which had like only state-level identifiers. And we find a similar association. We did this because the number of geotagged tweets is decreasing over time, and they actually make up a small portion of all tweets. But it seems like even doing analyses in non-geotagged tweets, we find essentially the same level, the same magnitude of association. So there is widespread geographical variation in the frequency of type of sentiment towards racial ethnic minorities. Social media seems to be able to, can be one source to assess racial sentiment. More negative racial sentiment, especially towards Blacks and Middle Eastern groups, was related to worse birth outcomes for the minority group as well as the full population. Analyses were cross-sectional. Social media data, like other data, like health survey data, relies upon people's willingness to report. And what's important to also note is that Twitter data doesn't capture direct experiences of discrimination necessarily, or cumulative experiences of individuals over a lifetime. We're not really looking at Twitter data as an individual level data source. We're aggregating it to say, okay, this is the racial sentiment at the county level. This is the racial sentiment at the state level. It's an indicator for us of the social context. And this is in contrast to lots of different data and research studies utilizing data from specific Twitter users and looking at their health outcomes. So for instance, like Twitter use relating to higher depression, for instance. But that's not really what we're doing. We're using Twitter data to measure the social context and not really at the individual level Twitter user. So we updated our Twitter data collection as we are continuing to collect data. So this includes Twitter data from 2015 to 2018. We added over 100 more race-related terms. We continue to look at birth outcomes, and this time we have about 10 million births. We utilize a new sentiment analysis model to support vector machines with a little bit higher accuracy at 91%. So here, for each year, state-level racial sentiment was merged on with data for birth. So we have 3 separate years. And this is controlling for also individual level maternal characteristics and state demographic characteristics. This is the state variability in sad race-related tweets. You see that more sad race-related tweets are present in the Northeast and the South. Across the 3 years, we see increased prevalence in sad race-related tweets across the states generally, and likewise a decrease in happy race-related tweets. So even with the addition of more years of data, we still see a robust relationship between proportion of race-related tweets that are negative and higher incidence ratio for birth weight and preterm birth. And this is apparent for minority mothers as well as white mothers. So climates that have higher racial hostility might just be more stress-inducing for everybody, for minorities, for whites, for people living there. So we also looked at other outcomes. In particular, we looked at hypertension, diabetes, obesity, stroke, MI, and coronary heart disease from the behavioral risk factor surveillance system. And we also utilized the survey to control for individual demographics. So we see that, for instance, people living in areas with more sad tweets had higher hypertension, higher stroke, higher MI, CHD, and CVD. So this is in alignment with the birth outcomes kind of analyses, where it adds a different set of outcomes, cardiovascular outcomes, which can be triggered by stress as well. So we're finding in our research that big data sources like Google Street View and Twitter can expand on what we view to be public health or social science data. And these seem to be consistently predictive of important health outcomes. And they, using this data, using these more computer science driven methods, represent a newer approach to measuring social environments, which can enhance research on social contexts and health. Thanks so much.